As I said in another clip, you have to take control to survive. I believe that so strongly. You have to be in control. You have to take control. Let me tell you a little bit about my story and the choices I've made and what I mean by this. Everything in life I have found with regard to my health has been linked. Never would have predicted it, but that's what's happened. And everything, when you go to seek medicine for whatever your health issue is, everything is not linked. Western medicine, doctors, in my opinion, still operate in what we call silos. They all operate differently. The oncologists operate differently than the orthopedist, than the person's doing plastic, cosmetic surgery, and so forth. So you have to be the one to make all the connections. That's my opinion. And that's what I do, and I think that's why 2 years out, I'm still thriving. Let me just give you a few examples. When I was hemorrhaging in the 80s because of fibroids, I had a hysterectomy. And the hysterectomy was fine. It stopped the hemorrhaging. I wasn't going to have any more children, so it was fine. And then as I got older, it was time to start to have colonoscopies because, I wanted to make sure that I didn't have colon cancer or any issues, which my mother had a polyp that was malignant, so I wanted to take care of my health. And I happened to find a doctor who was Chinese ancestry, and he said, everything's connected. And because they removed your uterus, now you have this space. You have this space in your pelvic region. And what's happened in your case, Mary, is all your intestines have filled that space that was left by removing your uterus. So your intestines all pile up and fill that space. So when he went to do my first colonoscopy, he couldn't do it. In fact, I went to another doctor before I met him, and they almost perforated my uterus. It was terrible. They couldn't get in. They just couldn't get through the intestines. Well, this old gentleman was so skilled, he rotated me, sort of like you do a animal when you're putting them on a spit and slowly turning them. He turned me and rotated me, controlled the air, so that he was able to get in and do a colonoscopy. And sure enough, I had a polyp. It wasn't malignant. He removed it. And thereafter, for the next few years, when I needed that procedure, I went to him. But then he retired. And of course, every time in my case, I found a great skilled doctor. They retired, and then I have to go look again. So in 2017, when I decided I better take care of my health, just routine screenings like mammograms and colonoscopy, I went to a physician and told him my history, that I was difficult to do the colonoscopies and why. And he said, well, we don't really have to go internally. We could do it a different way. Then you wouldn't need a driver. You wouldn't be in your twilight sleep. You could go home easier. He said, we can just do a 3D image. I said, sounds great to me. Let's do that procedure. It doesn't matter. I just need my routine screening. So he did a 3D image of my colon. And a couple days later, I got the phone call from him late one evening, and he said, the colon is fine, but there's been an incidental finding. He'd already talked to my family physician. I said, what does that mean? He said, I think you need to meet with your family primary care practitioner. There are some things that are worrisome that showed up in the 3D image that we never would have seen had we have done the traditional colonoscopy, and I want you to go talk to her. So a couple days later, I went over, and that's when they showed me all the tumors in the peritoneal omentum area throughout my whole abdominal pelvic region. I had these little serous tumors, and it was incidental. It was a blessing. Had they never have done that 3D image, they never would have found it. And so, luckily they found it because of that. That's what I mean, that things are connected. Because of that, when I went through the series of surgeries, because at the same week I also threw in the mammogram, and I got another call from my primary care who had just met me, I told her, she said, why are you here? I said, oh, I'm doing these routine screenings. And she said, what you want is insurance. I said, yeah, if I ever need any kind of medical procedure, I want to have a good facility lined up. And if not, I'll go on about my business. And in fact, those two screenings proved that, I had to activate my insurance immediately because the same week, same time, I happened to have a different type of tumor, different type of growth. The breast tumor was mucinous. So I had two different types of growth, two different areas. And then when they were doing the scans, they found another spot in my lung and so forth. So all of a sudden I was thrust into this situation that, of course, was alarming, made me fearful. But because I've been so trained as a scientist, I try to always think, what are the connections? What are the links? How can I solve this? What's the evidence? What's it based on? And so forth. That's just the way probably I'm genetically wired. So I went through the surgery for removing the serous tumors. It was supposed to be about 3 hours. It ended up being over 6 hours. The physician said it was the most complex surgery he's ever done in his career. They were all saying how long they had to sit and hold their arms like this and be at attention for my surgery. But anyway, after the surgery, they immediately then sent me to another doctor who wanted to do chemo. So all of a sudden, I started the chemotherapy immediately, not really having time to think about what I was doing and what they were doing. And so when I had the chemotherapy, all I could think of was the movie I'd seen years ago with Julia Roberts called Dying Young. And I searched and searched for it after my first chemo to just remind myself what that chemo was, because I remembered it for some reason as a kid. And sure enough, I found it. I only found it on YouTube. Somebody had copied it. And I thought, yep, that director did a great job. That's exactly what chemo feels like. It's the most miserable, painful, awful experience I could imagine. I had all kinds of medications for nausea and everything. So I wasn't nauseous, but 2-3 days after the first chemo infusion, I had two different types of chemo. My infusion was 5-6 hours all day. It was bad. And watching the movie Dying Young, I thought, boy, they did a great job making this movie because they captured the pain and misery perfectly. And I would just, to get relief, although I had all kind of pain meds and everything, I would just sit in the rocking chair all night and rock and rock and rock and rock to try to get my legs where it was really going. For some reason, the chemo in my legs just to stop hurting for about a week. And the second week, as you all know, if you've had chemo, gets a little better. By the third week, you're feeling pretty normal, but you're about ready to go through it again. So as I laid on the couch with the chemo, of course, I'm very aware of my body. I'm very sensitive to all kinds of medications. I mainly just needed extra strength Tylenol. I don't like opioids. They send me on all kinds of trips that are interesting and beautiful and exciting and I can remember, but they didn't take the pain away. So I would lay there and I could feel my tongue and pharynx and throat, and I would lose all sensation. So I had no taste. I could feel my tongue get thicker and more coated. And so it would take my taste away. And within the first 3 days, I'd lose 9 pounds. And I thought, I can't do this. I can't go to the emergency room. I got to stay strong. I got to have my body strong. I can't lose 9 pounds the first 3 days. I can't do it. And so I thought, if I suck on a lemon drop, pure lemon, I just tried it, before I would eat each time, the pure lemon would cut that coating that would appear on my tongue somehow, and it would restore my ability to taste. And so that's one little strategy I used. I would suck on these pure lemon drops, and then I could eat. The other thing I did, I tried to stay away from sugar and carbs because, they say sugar feeds cancer cells. But during those days, I would go buy fettuccine Alfredo. And I thought, this is the best thing I can eat, food I never would eat. I never would allow myself to indulge in fettuccine alfredo, but every time I had chemo, I would buy that, I would eat it, I would enjoy it, until the 9-pound weight loss would start to reverse itself. When I would start to gain weight again, then I'd go back on a better diet with fewer carbs and less sugar. But it was kind of like, this is the 3-day period where I can eat anything I want that I never normally would eat, and it stopped the weight loss. It made I imagine it made the little cancer cells happy, kind of satiated. Maybe they were a little sleepy or something. I wish somebody would have gone in with a little melon ball and scooped them out when they were kind of unconscious from their sugar buzz. But that's what I thought in my mind. Then I would feel the chemo go right to my knees. Now I had old knees from arthritis. It was genetic. Anyway, so my knees weren't the best. But every time I went to chemo, what was left of the cartilage in my knees, they were like Pac-Man. The chemo would go right to my knees. So for 3 days, I would feel this terrible, munchy, chewy, just eating away in my knees. And I would lay there and think, what do my knees have to do with my breast, my abdominal area, my pelvic area? Why is the chemo attacking my knees? What does this have to do with it, with my legs and lower extremities? So I would try to make the connections in my mind. And then, after the chemo stopped, for some of you know that have experienced, mine was hormone driven. So they wanted to block any hormones in my system. So then they put me on an aromatase inhibitor. And the aromatase inhibitor makes your muscles and your bones just ache, and your teeth, and it makes you age, and it does all kind of things to the elasticity in your body. So immediately you start to look like you're 80 years old when you're on this aromatase inhibitor. So I would think, what can I do? What can I do now? What can I choose now? And in another little clip, I'll tell you what I did to counter the effect of the aromatase inhibitors. I tried 2 strategies. They both worked, so I felt really reinforced that I found another evidence-based solution by the practices that I was choosing. So what does this mean by me telling you this? There's a mind-body connection that the alternative person, the websites that I talked about, will teach you. And the alternative strategies are something, again, that you can employ that have nothing to do, they won't tell you that, with your traditional medical appointments. But the mind-body experience kicks in, and I think helps with your survival. And let me tell you why I think one procedure links to another. I had a physical therapist, and he said, do you know what the difference is between God and a doctor, Mary? I said, no, I don't know. And he said, God knows he's not a doctor. So, little joke there. But he also said, there was a woman from another country, one of the Asian countries, I think, that left and wasn't able to finish her degree. She was in medical school. And so now she's in the States, and he knew her and met with her, and she's doing massage therapy because she wasn't able to complete her courses she needed to become a physician here in the States. And she said to him one day, he relayed this story when we were chatting about all the wonders of alternative medicine as well as traditional medicine. He said, one of the patients said, I had a problem with flies in my home. So the person got a fly swatter, swatted the flies, and the flies left. Next day, she came back to do more massage therapy, and the person said, I still have flies in my house. And so patient got a fly swatter, killed the flies. She went back on a 3rd time, and same thing happened. Said, I still have the flies. He got a fly swatter, got rid of the flies, and continued on. Her point was, when you have something that's an issue, and when you need to try to solve it, you need to look at it contextually from a different framework or from a different viewpoint. Now, again, when you look at some of my other tapes, you'll know that in my career, I studied cross-cultural communication. And I really love to look at cancer treatments around the world, not just from a Western perspective. Because I think, we can learn 5,000 years of history in Asia, or the blood tests they're doing in Greece now, and all kinds of things that you'll hear again in little clips. But this massage therapist point was to the man, instead of swatting the fly every day, why don't you just take out your trash? So I tell you that because the way you look at your cancer, I think, is linked to the outcome that you're going to have. And what I would encourage you to do is to look at the connections, stay in control, be creative, keep the faith. This is a great time because so many new findings are being discovered and appearing. So I'm encouraged. I don't like that I have cancer, but I don't think I need to beat the little cancer cells in me to death. I don't think I need to be so violent with them. I think that as long as they stay in their place, and we all kind of coexist here happily together. So a little bit of story that I hope you found interesting.